Question 1. A patient is diagnosed with uncontrolled type 2 diabetes mellitus with diabetic neuropathy. What is the correct coding sequence? A. E11.9, G63. B. E11.40, G58.0. C. E11.42, G99.0. D. E11.42, G63. Answer: D. E11.42, G63. This question tests your understanding of coding complications of diabetes mellitus. The keywords uncontrolled type 2 diabetes mellitus and diabetic neuropathy indicate a need for combination coding where possible or sequencing based on guidelines. ICD 10-CM guidelines require coding the diabetes code first, followed by the code for the complication. The correct code for uncontrolled type 2 diabetes with neuropathy is E11.42, and G63 represents polyneuropathy in diseases classified elsewhere, which is appropriate here. Always code the underlying condition, diabetes, first, followed by the manifestation, neuropathy, as directed by the instructional notes in the codebook. Remember to look for combination codes or sequence based on the specific manifestation and the diabetes category. Question 2. A patient presents with an acute exacerbation of chronic obstructive pulmonary disease, COPD, due to smoking. Which codes should be reported? A. J44.1. B. J44.9, F17.210. C. J44.0, J44.1. D. J44.1, F17.210. Answer: D. J44.1, F17.210. This scenario involves coding both an acute exacerbation of COPD and the associated smoking history. The term acute exacerbation of chronic obstructive pulmonary disease leads you to code J44.1. The phrase due to smoking requires an additional code to indicate the history of tobacco dependence. F17.210 is the correct code for nicotine dependence, cigarettes, uncomplicated, which is appropriate for a history related to the current condition. Remember to capture all relevant diagnoses supported by the documentation, including current conditions and significant history like tobacco dependence that affects the current health status. Question 3. A patient falls from a ladder at home and sustains an open fracture of the right tibia. Which external cause code category should be used? A. W00W19. B. V00V99. C. Y90Y99. D. X00X59. Answer: A. W00W19. This question focuses on assigning the correct external cause code category for an injury. The keyword fall specifically from a ladder at home directs you to the W00W19 category in the ICD 10-CM External Causes Index. This category is designated for falls. The V codes, V00V99, are for transport accidents, Y codes, Y90Y99, are for supplementary factors, and X codes, X00X59, are for exposure to inanimate mechanical forces, none of which apply here. Always refer to the External Causes Index first when coding injuries to find the appropriate code reflecting the mechanism and circumstances of the injury. Question 4. A patient is admitted for elective hip replacement surgery due to severe osteoarthritis of the hip. What is the correct principal diagnosis? A. Z47.1. B. M16.50. C. Z09.8. D. M16.9. Answer: D. M16.9. This question asks for the principal diagnosis for a surgical admission. The principal diagnosis is the condition chiefly responsible for the patient's admission to the hospital. In this case, the reason for the hip replacement surgery is the severe osteoarthritis of the hip. M16.9, unspecified osteoarthritis of hip, is the code for the underlying medical condition requiring the surgery. Z codes, Z47.1, Z09.8, relate to aftercare or follow-up, not the condition causing the admission. Remember that for surgical admissions, the principal diagnosis is typically the condition being treated by the surgery, not the procedure itself or postoperative care needs. Question 5. A patient is seen for a follow-up visit after a successfully treated myocardial infarction that occurred 3 months ago. Which code should be reported for the follow-up? A. I21.9. B. Z09.0. C. I25.2. D. Z08. Answer: C. I25.2. This question tests your knowledge of coding sequelae or history of certain conditions. The patient is past the initial healing phase of the myocardial infarction, successfully treated 3 months ago, and is now in the follow-up stage for the history of the MI. I25.2 is the correct code for old myocardial infarction, which is used for a healed MI. I21.9 is for an acute MI, which is not applicable here. Z codes, Z09.0, Z08, are for follow-up exams after treatment for conditions like malignant neoplasms, not typically for a healed MI itself. When coding a history of a condition that has residual effects or requires long-term follow-up related to the history, look for specific history of or old codes. Question 6. A patient has documentation of hypertension and chronic kidney disease stage 3. Which codes should be assigned? A. I10, N18.3. B. I12.9, N18.3. C. I13.10, N18.3. D. I13.11, N18.3. Answer: D. I13.11, N18.3. This question involves coding co-occurring hypertension and chronic kidney disease, CKD. ICD-10-CM assumes a causal relationship between hypertension and CKD unless the documentation states otherwise. Therefore, a combination code is usually appropriate. I13.11 is the correct combination code for hypertensive heart and chronic kidney disease with stage 1 to 4 chronic kidney disease, which accurately reflects both conditions. N18.3 is the code for chronic kidney disease, stage 3, and is reported in addition to the combination code as instructed by the code description for I13.11. Always look for combination codes when hypertension and CKD are both documented, and be sure to assign the appropriate CKD stage code as a secondary diagnosis. Question 7. A patient presents with nausea and vomiting due to acute gastroenteritis. Which codes should be reported? A. R11.2, A09. B. A09. C. A09, R11.2. D. R11.0, R11.10, A09. Answer: B. A09. This question tests your understanding of coding symptoms associated with a definitive diagnosis. The documentation states nausea and vomiting due to acute gastroenteritis. Gastroenteritis is a definitive diagnosis that explains the symptoms of nausea and vomiting. In ICD-10-CM, you do not typically code symptoms, or codes, when a definitive diagnosis explaining those symptoms is provided. A 09 is the correct code for infectious gastroenteritis and colitis, unspecified. Since the symptoms are an integral part of the gastroenteritis, only the diagnosis code is necessary. When the physician documents a definitive diagnosis, code only the diagnosis and not the symptoms that are routinely associated with it. Question 8. A patient is scheduled for a colonoscopy for screening. During the procedure, a polyp is found and removed. What is the primary reason for the encounter? A. Encounter for screening for malignant neoplasm of colon, Z12.11. B. Polyp of colon, K63.5. C. Removal of polyp, Z86.010. D. Colonoscopy, Z53.79. Answer: A. Encounter for screening for malignant neoplasm of colon, Z12.11. This question asks for the primary reason for the encounter. Even though a polyp was found and removed, the reason the patient came in was for the screening colonoscopy. ICD-10-CM guidelines state that when a screening encounter results in a finding, the appropriate screening code is sequenced first, followed by codes for the findings. Z12.11 is the correct code for the screening. The polyp, K63.5, would be coded as a secondary diagnosis. Remember that the primary diagnosis reflects the reason the patient sought care, even if additional findings are discovered during the visit. Question 9. A patient is diagnosed with primary osteoarthritis of the right knee. What is the correct ICD-10-CM code? A. M17.10. B. M17.11. C. M17.12. D. M17.9. Answer: B. M17.11. This question requires you to select the correct code for primary osteoarthritis in a specific joint and side. The keywords are primary osteoarthritis, right knee. M17 is the category for osteoarthritis of knee. M17.1 specifies primary osteoarthritis of knee. The fourth character indicates the specific knee, and the fifth character indicates laterality. M17.11 is the correct code for primary osteoarthritis, right knee. Pay close attention to laterality, right/left, and the type of osteoarthritis, primary/secondary, when coding joint conditions. Question 10. A patient with known coronary artery disease, CAD, presents with unstable angina. What is the correct codes? A. I20.0. B. I25.10. C. I20.0, I25.10. D. I25.10, I20.0. Answer: C. I20.0, I25.10. This scenario involves coding both unstable angina and underlying coronary artery disease. The documentation specifies unstable angina, which is coded with I20.0. It also states the patient has known coronary artery disease, coded with I25.10. ICD-10-CM guidelines instruct that when a patient with known CAD is admitted due to unstable angina, codes for both unstable angina and the underlying CAD should be assigned, with the unstable angina code sequenced first. Therefore, I20.0 is the principal diagnosis, followed by I25.10. Always sequence unstable angina before chronic ischemic heart disease when both are present. Question 11. A patient is diagnosed with community-acquired pneumonia. What is the correct ICD-10-CM code? A. J18.9. B. J15.9. C. J18.0. D. J10.0. Answer: A. J18.9. This question asks for the code for community-acquired pneumonia when the specific organism is not identified. The keyword community-acquired pneumonia refers to pneumonia contracted outside of a healthcare setting. While the term itself doesn't provide an organism, in the absence of documentation specifying the causative agent, you default to unspecified codes. J18.9 is the code for pneumonia, unspecified organism. J15.9 is bacterial pneumonia, unspecified, which isn't appropriate without knowing it's bacterial. J18.0 is for bronchopneumonia, unspecified, a different type. Always default to the unspecified code, J18.9, for pneumonia when the organism isn't documented, unless directed otherwise. Question 12. A patient is admitted for dehydration due to chemotherapy for metastatic bone cancer. What is the correct principal diagnosis? A. C79.51. B. E86.0. C. Z51.0. D. C80.1. Answer: B. E86.0. This question tests your understanding of sequencing when a patient is admitted for a complication of treatment. The patient is admitted specifically for dehydration. This is the condition being treated upon admission, making it the principal diagnosis. E86.0 is the code for dehydration. The metastatic bone cancer, C79.51, and the chemotherapy, Z51.0, are important secondary diagnoses, but the reason for the hospital admission is the dehydration caused by the therapy for the cancer. When a patient is admitted for a complication resulting from a medical treatment, the complication code is typically the principal diagnosis, followed by codes for the underlying condition and the treatment. Question 13. A patient presents with acute appendicitis with generalized peritonitis. What is the correct codes? A. K35.3. B. K35.2. C. K35.3, K65.0. D. K35.2, K65.0. Answer: D. K35.2, K65.0. This question involves coding acute appendicitis with a complication. The phrase acute appendicitis with generalized peritonitis requires codes for both the appendicitis and the resulting peritonitis. K35.2 is the code for acute appendicitis with generalized peritonitis. ICD-10-CM guidelines instruct that when a combination code exists for a condition and its complication, that combination code should be used if it fully describes the condition. However, in this specific case, K35.2 is described as acute appendicitis with generalized peritonitis. A separate code for peritonitis, K65.0, is also assigned to fully capture the extent of the condition. Always check the tabular list and index carefully for specific instructions on coding complications. Question 14. A patient is seen for management of type 2 diabetes mellitus with diabetic retinopathy and diabetic nephropathy. What is the correct coding sequence? A. E11.311, E11.21. B. E11.21, E11.311. C. E11.69. D. E11.29, E11.311. Answer: C. E11.69. This question tests your ability to use combination codes for multiple complications of diabetes. The documentation lists type 2 diabetes mellitus with both diabetic retinopathy and diabetic nephropathy. ICD-10-CM has combination codes for type 2 diabetes with multiple complications. E11.69 is the code for type 2 diabetes mellitus with other specified complications. This code is appropriate when the patient has multiple complications that don't fall under a more specific combination code. Always look for a single code that can represent multiple complications of diabetes before coding each complication separately. Question 15. A patient is brought to the emergency department after being hit by a car while riding a bicycle. The patient sustained a fractured femur. Which code categories are needed? A. Injury code, external cause code, place of occurrence code, activity code. B. Injury code, external cause code. C. Injury code, place of occurrence code, activity code. D. External cause code, place of occurrence code, activity code. Answer: A. Injury code, external cause code, place of occurrence code, activity code. This question asks for the full set of codes required for an injury caused by an external event. When coding injuries, you need not only the code for the injury itself, fractured femur, but also codes explaining how and where it happened. This requires an injury code from the S or T chapters, an external cause code, VY codes, specifying the mechanism, hit by car while bicycling, a place of occurrence code, Y92, indicating where it happened, e.g., street, and an activity code, Y93, indicating what the person was doing, bicycling. Remember to capture all four elements, the injury, the cause, the place, and the activity, for comprehensive injury coding. Question 16. A patient presents with acute bronchitis. What is the correct ICD 10-cm code? A. J20.9. B. J40. C. J42. D. J44.9. Answer: A. J20.9. This question asks for the basic code for acute bronchitis. The term acute bronchitis directly points to the J20 category. In the absence of documentation specifying the causative organism, the correct code is the unspecified one. J20.9 is the code for acute bronchitis, unspecified. J40 is for bronchitis, not specified as acute or chronic. J42 is for chronic bronchitis. J44.9 is for chronic obstructive pulmonary disease, unspecified. When the documentation simply states acute bronchitis without further detail on the cause, J20.9 is the appropriate code. Question 17. A patient is diagnosed with malignant neoplasm of the lower inner quadrant of the right female breast. What is the correct code? A. C50.411. B. C50.412. C. C50.419. D. C50.911. Answer: A. C50.411. This question requires precise coding for a malignant neoplasm based on location and laterality. The keywords are malignant neoplasm, lower inner quadrant, right female breast. C50 is the category for malignant neoplasm of breast. C50.4 specifies malignant neoplasm of lower inner quadrant of breast. The sixth character indicates laterality and gender. C50.411 is the code for malignant neoplasm of lower inner quadrant of right female breast. Pay close attention to the specific quadrant and laterality documented to ensure you select the most granular code available. Question 18. A patient is seen for a routine annual physical examination. Which code should be reported? A. Z00.00. B. Z00.01. C. Z01.419. D. Z02.0. Answer: A. Z00.00. This question asks for the code for a routine general medical examination. The term routine annual physical examination directly leads to the Z00 category, which is for encounters for general examination without complaint, suspected or reported diagnosis. Z00.00 is the code for encounter for general examination without abnormal findings. Z00.01 is for examination with abnormal findings. Z01.419 is for gynecological examination. Z02.0 is for examination for admission to institution. A routine annual physical where nothing abnormal is found is coded with Z00.00. Use Z00.00 for healthy patients receiving routine checkups with no significant issues found. Question 19. A patient presents with dizziness and is diagnosed with benign paroxysmal positional vertigo. What is the correct ICD 10-cm code? A. R42. B. H81.00. C. H81.10. D. H81.01. Answer: D. H81.01. This question requires coding a specific type of dizziness. The diagnosis, benign paroxysmal positional vertigo, is a specific condition, not just the symptom of dizziness. H81 is the category for disorders of vestibular function. H81.0 is for Meniere's disease, which is incorrect. H81.1 is for benign paroxysmal positional vertigo. The fifth character specifies laterality. H81.11 is for the right ear, H81.12 for the left, H81.13 for bilateral, and H81.10 for unspecified. The question doesn't specify laterality, so H81.10 is the most appropriate code based on the documentation. When a specific diagnosis for a symptom like dizziness is provided, code the diagnosis rather than just the symptom code, R42. Question 20. A patient has a history of a completed stroke with residual right-sided weakness. How should this be coded? A. Z86.73. B. I69.351. C. I63.9, G81.94. D. I69.351, G81.94. Answer: B. I69.351. This question tests coding sequelae of a cerebrovascular accident, stroke. The patient has a history of a completed stroke with residual right-sided weakness. In ICD-10-CM, sequelae of cerebrovascular disease are coded using codes from category I69, followed by codes describing the specific deficit, the weakness. I69.3 is for sequelae of cerebral infarction. The fifth character indicates the specific sequela, and the sixth character indicates laterality. I69.351 is the code for sequelae of cerebral infarction affecting right dominant side, which includes hemiparesis/hemiplegia. You do not code the acute stroke, I63.9, or the general paralysis code, G81.94, separately when the I69 code exists and describes the sequela. Use the I69 code to capture the history and the specific residual deficit. Question 21. A patient is diagnosed with acute kidney injury superimposed on chronic kidney disease stage 4. What is the correct coding sequence? A. N17.9, N18.4. B. N18.4, N17.9. C. N17.9, N18.9. D. N18.6. Answer: A. N17.9, N18.4. This scenario involves coding both acute kidney injury, AKI, and chronic kidney disease, CKD. When a patient has AKI superimposed on CKD, ICD-10-CM guidelines require coding both conditions. The AKI is the acute condition and is sequenced first. N17.9 is the code for acute kidney failure, unspecified, or a more specific AKI code if available. N18.4 is the code for chronic kidney disease, stage 4. When both AKI and CKD are documented, sequence the AKI code first, followed by the CKD code to indicate the acute problem on top of the chronic condition. Question 22. A patient presents with a fever of unknown origin. What is the correct ICD-10-CM code? A. R50.9. B. R50.2. C. R68.89. D. R50.81. Answer: A. R50.9. This question asks for the code for a nonspecific symptom when the underlying cause is not identified. Fever of unknown origin is a symptom. When a definitive diagnosis for the fever is not established, you code the symptom. R50.9 is the code for fever, unspecified. R50.2 is for drug-induced fever. R68.89 is for other general symptoms and signs. R50.81 is for fever presenting with conditions classified elsewhere. Since the cause is unknown, the unspecified fever code is appropriate. Code symptoms when the underlying cause has not been determined and documented by the provider. Question 23. A patient is diagnosed with anemia due to chronic blood loss from a duodenal ulcer. What is the correct coding sequence? A. K26.9, D62. B. D62, K26.9. C. K26.9, D50.0. D. D50.0, K26.9. Answer: D. D50.0, K26.9. This question tests coding a manifestation, anemia, due to an underlying condition, ulcer with chronic blood loss. ICD-10-CM guidelines generally require coding the manifestation first, followed by the underlying condition when there is a due-to relationship where the manifestation is a direct result of the underlying cause. D50.0 is the code for iron deficiency anemia secondary to blood loss, chronic. K26.9 is the code for duodenal ulcer, unspecified as acute or chronic, without hemorrhage or perforation. The anemia is the manifestation of the chronic blood loss from the ulcer, so it is sequenced first, followed by the code for the ulcer. Code the manifestation first, then the underlying condition when the documentation indicates one condition is caused by another, unless specific index or tabular instructions dictate otherwise. Question 24. A patient presents with nausea and vomiting following surgery. The physician documents postoperative nausea and vomiting. What is the correct ICD-10-CM code? A. T81.9XXA. B. R11.2. C. G90.8. D. K91.0. Answer: D. K91.0. This question involves coding a complication specifically related to a procedure. The phrase postoperative nausea and vomiting indicates this is a complication of surgery. K91.0 is the specific ICD-10-CM code for vomiting following gastrointestinal surgery, although it's commonly used for postoperative nausea and vomiting in general. T81.9XXA is for unspecified complication of procedure, which is too general. R11.2 is a symptom code and not appropriate when the specific cause, postoperative, is known. G90.8 is for other disorders of autonomic nervous system. When coding complications, look for codes within the K90-K95 chapter, intraoperative and post-procedural complications and disorders of digestive system, or specific complication codes related to the procedure chapter. Question 25. A patient is diagnosed with essential hypertension. What is the correct ICD-10-CM code? A. I10. B. I15.9. C. I12.9. D. I13.0. Answer: A. I10. This is a straightforward question asking for the code for the most common type of hypertension. Essential hypertension is synonymous with primary hypertension. I10 is the specific ICD-10-CM code for essential, primary, hypertension. I15.9 is for secondary hypertension, unspecified. I12.9 is for hypertensive chronic kidney disease. I13.0 is for hypertensive heart and chronic kidney disease. When the documentation states essential hypertension, always use the I10 code. Remember that I10 is the default code for hypertension unless specified as secondary or involving the heart or kidneys.